My name is Rachel Orth. I'm 33 years old, and I am a stay-at-home mom. I am a wife. I have 3 young kids, ages 10, 7, and 4 years old. In November of 2020, I went in for my well woman visit. They happened to find a mass on my ovaries. We proceeded scheduling a surgery to remove what we thought was a benign tumor. And I woke up to the news that I had cancer. After being discharged from the hospital, because of COVID-19, my first oncology appointment was a telehealth appointment. That's when I was first told that I was a stage 4 gastric patient, that the cancer was terminal, and that my prognosis was very poor. It was over a Zoom call. It was devastating. It really was. So my first thought was, oh no, what's going to happen to my family? Suddenly my life went from, school drop-offs and pickups and taking care of my preschooler to a lot of doctor appointments and scans and infusions and not feeling well. I was told very early on that my best option, my best hope was to pursue clinical trials because there is very limited treatment options for the type of cancer that I have. But before I could qualify for that, I needed to have some procedures done. I needed to have an endoscopy, I needed to have a colonoscopy and a laparoscopy. And a few days before they were scheduled, my husband came down with COVID-19 symptoms. And then I became symptomatic. Started running a fever, went in and got tested. It was positive. And so that meant postponing those appointments again. All told, it was about a month, which feels like a really long time when you've been given a really poor prognosis of months to a year to live.
1, 2, 3.
Whoa, buddy. We immediately got support and started counseling. However, because of COVID-19, that's all virtual, which has been difficult. I have not ever seen my counselor face to face. She said one day on the phone, she's like, I just really want to give you a hug. And I'm sorry that I can't, because right now you're dealing with a lot of grief. And you're doing it alone, which is hard. Sorry. Right now I'm doing really, really well. I am in the middle of doing a clinical trial, a phase 1 clinical trial with MD Anderson. My scans have shown disease is stable. And so we're really thankful for that. Knowing the aggressive nature of gastric cancer, I've been able to function as a mom. I still get to interact with my kids, do all the things with them. I think that more funding for cancer research, cancer treatment options is very important right now. Being part of that phase 1 clinical trial is what is keeping my cancer stable. It's what's giving me hope for the future. And so I believe that funding for research to continue that expansion of treatment options is really important.